USMLE-style question on caudal neuropore defect. A newborn is delivered via spontaneous vaginal delivery to a 28-year-old woman with no significant past medical history. The infant is found to have a sac-like protrusion in the lumbosacral region covered by a thin membrane. Neurological examination reveals decreased lower limb muscle strength and absent deep tendon reflexes in the legs. MRI confirms herniation of the meninges and spinal cord through a bony defect in the vertebral column. Which of the following best describes the embryologic defect responsible for this condition? A. Failure of the rostral neuropore to close during the 4th week of development. B. Failure of the caudal neuropore to close during the 4th week of development. C. Failure of lateral body folding during the 4th week of development. D. Defective migration of neural crest cells during neurulation. E. Failure of the notochord to induce overlying ectoderm to form neuroectoderm. Answer B. Failure of the caudal neuropore to close during the 4th week of development. Explanation. This newborn has myelomeningocele, a type of spina bifida, caused by failure of the caudal neuropore to close by the 4th week of embryonic development. Pathophysiology. The caudal neuropore normally closes around day 27. Failure to close leads to spina bifida, which can present as spina bifida occulta mildus no herniation, meningocele, herniation of meninges only, myelomeningocele, herniation of meninges and spinal cord, as in this case. Clinical features of myelomeningocele: lumbosacral defect with a cystic mass, neurologic deficits, e.g., weakness, sensory loss, bowel bladder dysfunction, increased afetoprotein AFP in maternal serum and amniotic fluid, associated with Arnold-Chiou-2 malformation and hydrocephalus. Incorrect options. A. Failure of the rostral neuropore to close during the 4th week causes anencephaly, not spina bifida. C. Failure of lateral body folding during the 4th week leads to ventral body wall defects, e.g. gastroschisis, omphaloceal. D. Defective migration of neural crest cells causes neurocrestopathies, e.g. Hirschsprung disease, DeGeorge syndrome. E. Failure of the notochord to induce overlying ectoderm would prevent neural tube formation entirely, not just affect closure. This question assesses knowledge of neurulation defects and their clinical consequences.